This is Dr. Sargisian, and today we'll talk about cardiovascular system diseases and disorders. Just a brief review of cardiovascular system, and cardiovascular system includes heart, arteries, veins, and blood. Heart is a muscular organ, and usually it's a very approximate way to describe it. The size is of a man's fist. Of course, size vary in each individual, and when we're saying the size of the man's fist, it's we are talking about the adult person. It has 4 chambers, and we know that most mammals have 4 chambers, and in biology there may be made distinction between 3-chamber and 4-chamber species, although of course the focus of this presentation is not the biology, but still I'd like to mention that you may recall that some species have 3-chamber hearts or less. The heart diagram, of course you all already familiar with this, and you know the flow of blood here, how it flows, and the blood flow is in the system, which is a closed system, and heart and lungs connected together with arteries and veins. A couple of things here I want to mention to you. Left pulmonary and right pulmonary veins, these are actually arteries in sense that they have oxygenated blood. However, we name arteries and veins based on the direction of blood flow. So it doesn't matter blood is oxygenated or not, but if it conducts, if the movement is towards the heart, it's a vein, and if it away from heart, it's an artery. So that's the distinction. Important thing about the heart, its structure and ability. It's a muscular structure which is different in skeletal muscle, in the sense that heart has automaticity, as well as heart has ability to transfer the electric impulse very rapidly between the cells. Also, the part of it that heart, of course, has the Purkinje fibers that allow the transport of electric impulse very quickly. One of the important concepts in studying the heart, it's the layer of the heart muscular structure, and myocardium is the inside layer, its actual muscular structure, and the cardium is the inside lining of the heart, inside lining of the chambers. Epicardium is outside lining of the chambers. Several diagnostic tests can be performed with heart, and more and more we are moving toward non-invasive procedure. However, some non-invasive procedures such as auscultation are very old, but other non-invasive procedures are relatively new. Cardiac catheterization is certainly an invasive procedure, and involved inserting the catheter through the vascular system to further evaluate the heart, or even have interventions. In this case, X-rays having less and less value nowadays as diagnostic procedures. Imaging may include angiography, venogram, and one of the most important tests, or not one, but the group of tests, it's the blood testing for cardiac enzymes. And cardiac enzymes, of course, will be cardiac specific and cardiac non-specific. And by testing for cardiac enzyme, we certainly may determine onset of adverse cardiac events such as myocardial infarction.